Head Adult Hematology and BMT Consultant at Narayana Health City, Bangalore. And we have Dr. Rohit Ranade, Consultant Gynecology Oncology at Narayana Health City, Bangalore. I request Dr. Dr. Sharad Damodar to address the media.
Start from here. Okay. So good afternoon, everybody. And first of all, I'd like to thank all of you all for taking time out and actually coming for this little meet which we organized. So a big thank you for actually attending this event. So the idea of this event was to basically showcase Narayana Health and its services. I think most of you all would already know about Narayana Health. This was something which was a hospital first started by Dr. Devi Shetty, initially in Calcutta, then in Bangalore, and now across India, there are close to about 30 odd hospitals across the country with all kinds of treatments available. Initially, it was only cardiac care, but now it's a big name in oncology, in diabetology, where it is surgical services, a lot of the medical services. So it's basically a tertiary care center which is recognized for all kinds of healthcare. And clearly, our idea was at some point in time, we thought that we should have these services even available to the people of Goa, even though we don't have an official hospital here as part of Narayana Health. The idea was at least some of these services which could be made accessible to patients from here, because it is a referral and we do see patients coming across for some of the high-end treatments. So with that intent in mind, the idea was to start some kind of OPD-based services initially, to have some tie-up with some of the local hospitals here, and then have physicians and surgeons visiting here, and also allowing some of that care to be done here itself, because that's the best thing from a patient perspective, so that if it's accessible here, then it's easier. Except if there is some very high-end therapies, which is high-end robotic surgery, or the immunotherapies and transplants, some of which is very high-end and requires a lot of infrastructure, then for that, some of them would require to access some of the larger hospitals of Narayana, which is there across the country, with the main hub being in Health City in Bangalore. So so that's the general intent of promoting this. And clearly we think that by getting some of the specialized services available to people here, it will certainly help people to obtain that expertise and avail of that service locally. So that's the primary intent of trying to upgrade the level of care available for patients here in Goa. So that's the few words I would like to start the introduction. I will now request Dr. Rohit also to continue and add something from the oncology perspective.
English चालेल का मराठी पण चालेल? Anything. Okay. So basically, I think first of all, thank you for coming in large numbers for our and giving us an opportunity. Basically, sir has already put forward that we are a chain with 35 hospitals. Previously, we were only in cardiac care, but now we are coming in oncology, transplants, and other branches as well. So the primary aim is to start OPD services. First, we will be starting services for oncology services. As you know, the incidence of cancer is increasing. It is increasing all over India. It is increasing, similarly it is increasing the state of Goa as well. So the intent first is to start OPD services, where we will screen patients, we will diagnose patients. ज्या काही treatments इथे possible आहेत, small things like biopsy, like other things will be done here only. But if the patient requires high-end facilities, म्हणजे ज्यांच्यामध्ये काही जणांमध्ये robotic surgery लागू शकते, काही जणांमध्ये immunotherapy लागू शकते, काही जणांमध्ये bone marrow transplant लागू शकते, which is a very very intensive treatment. म्हणजे ज्याच्यामध्ये the treatments are not simple. That will be done at our main center in Bangalore, which is a state-of-art center. And similarly, simultaneously, we have tied up with Daffodils Hospital at present, which is in Vasco, which we will be starting our OPD services. And slowly we will expand from oncology to cardiac care and to transplants as well. And we will see how it is going. We hope that with this, the people of Goa will be able to get the expertise of our consultants, and which can help them to guide them in their treatments. Thank you. If there are any questions, we will be happy to answer.
How many people do visit Bangalore from Goa?
So we don't have the official number, but on an average, we see at least about, like my unit sees about 2 to 3 patients from Goa. If you put together, I think it must be at least around somewhere between 20 to 25 patients from Goa if you take all our hospitals, entire hospital together?
So they come in primarily for very high-end care not available here. So there is cardiac surgery which is not available here at all in Goa. There is pulmonary endarterectomy. There is very complicated, aortic root replacement surgery. There is some, the TAVI procedure which is not done in some of these hospitals. So that is one spectrum. Okay. We've had patient referrals for transplant. So bone marrow transplant, stem cell transplant have come from Goa. Now there is a new thing called immunotherapy, which is now coming up in a lot of the cancer treatments. That also currently is actually not available in Goa. So these are centers which require some specialized infrastructure, which is why the referrals actually come in. So it's only that segment. We're not saying that just for routine care and all that we get any such thing. So clearly there is a very niche area for which there is specific referral.
Yeah, I had been procedures to something. गोव्यात कुठे अवेलेबल नाही म्हणजे मणिपाल असू दे किंवा ते ICU आहे एवढे सगळे हॉस्पिटल आहेत मोठे मोठे त्यांच्याकडे सर्व्हिसेस अवेलेबल
नाही. त्याच्यामध्ये सुद्धा कसं आता कार्डियक सर्जरी म्हणजे इट इज नॉट जस्ट कार्डियक सर्जरी. आता त्याच्यामध्ये जी सिंपल कार्डियक सर्जरी आहे बायपास दॅट माइट बी अवेलेबल. पण जसं सरांनी सांगितलंय की देयर आर सर्टन व्हेरी हाय एंड प्रोसिजर्स म्हणजे पल्मनरी एंडार्टेक्टमी इज अ व्हेरी वन ऑफ द मोस्ट कॉम्प्लेक्स प्रोसिजर्स इन कार्डियक. तर ते अवेलेबल नाही. जसं आता लेटेस्ट इम्युनोथेरपीज जे असतात त्याच्यामध्ये ते देण्यामध्ये किंवा बोन मॅरो ट्रान्सप्लांट करण्यामध्ये देयर आर लॉट ऑफ अदर थिंग्स ऑल्सो. ते जरासं जटिल असतं. इट इज नॉट लाईक अ सिम्पल थिंग. जसं काही मेजर सर्जरी असतात जसं सायटोरेटिव्ह सर्जरी अँड हायपॅक म्हणजे त्याच्यामध्ये 8-10 तासाची सर्जरी असती. त्याच्यानंतर त्याच्यामध्ये किमोथेरपी पण दिली जायची. तर हे सगळे पेशंट्स हॅव टू बी मॅनेज्ड इन अ मल्टी स्पेशालिटी व्हेरी विथ वेल ट्रेन्ड स्टाफ आणि बाकी फॅसिलिटीज पण जास्त पाहिजे. जसं बोन मॅरो ट्रान्सप्लांट करणं इट इज क्वाईट डिफिकल्ट कारण त्याच्यामध्ये पेशंटचा बोन मॅरो पूर्ण रिप्लेस केला जातो म्हणजे इट इज लाईक गिव्हिंग अ न्यू लाईफ टू हिम. सो त्याच्यामध्ये दिस फॅसिलिटीज आर नॉट अवेलेबल ॲज ऑफ नाउ.
But you require donor for that.
Yes, so there are two types. One is the autologous, which is easier to do, where you take your own cells. But the allogenic for diseases like leukemia, MDS, thalassemia, aplastic anemia, where you need a donor. So a lot of times it will be a sibling, or sometimes it will be even a half-matched parent or child, which is the latest kind of therapy, which is currently actually not available in the state. And we already know patients are going to Bangalore or Bombay for these kind of treatments.
आता पूर्वी कसं होतं की मोस्ट ऑफ द टाइम्स कॅन्सरमध्ये सर्जरीज वर ओपन सर्जरीज म्हणजे पोट इकडनं ओपन केलं जायचं आणि सर्जरी केली जायचं. पण आता दॅट हॅज चेंज विथ टेक्नॉलॉजी. सो वी डोंट नो लॉंगर डू दॅट. वी डू समथिंग कॉल्ड रोबोटिक सर्जरी म्हणजे रोबोटच्या साह्याने सर्जरी केली जाते. तर रोबोट डझंट डू द सर्जरी. इट्स अ सर्जन विच डज द सर्जरी. त्याच्यामध्ये काय होतं की पेशंट रिकव्हरी इज व्हेरी फास्ट. म्हणजे पूर्वी जर 3 आठवडे लागत असतील तर आता 1 आठवड्यातच रिकव्हर होते. पेन जे सर्जरी नंतर कुठल्या पण पेशंटला तुम्ही विचारलं तर विच इज मोस्ट डिस्ट्रेसिंग तर दॅट इज पेन. ते पेन इज रिड्यूस्ड बाय ॲटलीस्ट 4/5 म्हणजे 75% रिडक्शन इन पेन होतं. त्याच्यामुळे बेसिकली पेशंटचं क्वालिटी ऑफ लाईफ इज मच बेटर. सच हाय एंड ट्रीटमेंट्स आर अवेलेबल ॲट आवर सेंटर.
The cost also goes high for that. What are your
So cost is like it does in terms of how you look at it. In that way, as compared to other hospitals, we are quite an affordable hospital because we believe that if something cannot be affordable for the population, it is not viable. So त्याच्यामध्ये and there are a lot of insurances which are now supporting all these treatments. And that is how we look to sort of cut down the cost also. Plus the numbers that we do a lot of numbers. So when we do more numbers, you can reduce on the cost because instead of doing 1 surgery a day, we can do 3 to 4 surgeries a day. So the overall cost comes down.
तुमची पूर्ण टीम गोव्यात वर्षाच्या 12 महिने असणार का कधी अपॉइंटमेंट असतं तरच ते
सो त्याच्यामध्ये सायकल असणार म्हणजे प्रत्येकाचं समजा आठवड्यातनं एकदा प्रत्येक डिपार्टमेंट असं ओपीडी करणार म्हणजे दॅट वी विल वर्क आउट. म्हणजे कसं येणार अपॉइंटमेंट बेसिस वरतीच असणार.
सर गोव्यात ओव्हरऑल बघितलं तर इतर राज्यापेक्षा गोव्याची हेल्थ सर्व्हिसेस आहे खूप चांगली आहे. गव्हर्नमेंट सुद्धा रोबोटिक सर्जरी करते. पण या सगळ्या गोष्टी असताना जी नारायण हेल्थ सर्व्हिस गोव्यात सुरू करताय ती कितपत फायदेशीर ठरेल असं वाटतं तुम्हाला?
या दॅट इज अ व्हेरी गुड क्वेश्चन. आय एम नॉट अवेअर. मला माहित नाही म्हणजे गोवा गव्हर्नमेंटमध्ये ऍक्च्युली रोबोटिक सर्जरी आहे का नाही. पण बेसिकली काय आहे की आपले गव्हर्नमेंट आय नो दॅट गोवा गव्हर्नमेंट हॉस्पिटल इज वन ऑफ द फॅन्टास्टिक हॉस्पिटल्स पब्लिक हॉस्पिटल्स इन द एंटायर कंट्री. पण ओव्हरऑल काय आहे की आपलं पॉप्युलेशनच एवढं आहे की मे बी that it may not suffice for the entire population. So that is where we are looking at. Plus there are lot of म्हणजे इथनं जे आमचे जे पेशंट्स आमच्याकडे आलेले आहेत त्यांचे खूप नातेवाईक बँगलोरमध्ये असतात. So for us, for them also it is quite easy. So that is what we are looking at.
आणि वास्को बेस करण्याचं काय मुख्य कारण आहे?
असं काही कारण नाहीये वास्को बेस करण्याचं. पहिल्यांदा वी आर स्टार्टिंग इट इन वास्को, बट वी आर लुकिंग एट अदर ऑप्शन्स ऑल्सो वेअर वी आर लुकिंग एट स्टार्टिंग ओपीडी सर्व्हिसेस एट अदर प्लेसेस लाईक पणजी और इन नॉर्थ गोवा ऑल्सो.
आपले हाय इक्विपमेंट्स आहेत ना ते तुम्ही इकडे पण घेऊन येणार का असा प्लॅन आहे पुढे?
So that's what I mentioned. So currently, if we have a facility of Narayana in Goa, then that is doable, which is what has happened in other places. So now there is center in so Jaipur and Ahmedabad and Raipur and all that, where when NHS opened the center with the tie-up with the local person, then they are able to set up some of the infrastructure. So I'm hoping that that will happen as the next step. Which is what has happened in elsewhere, because we run clinics. I do OPD in multiple places, and we have realized that over a period of time, because of the trust factor, people want to then tie up the local people. Then the infrastructure also then builds up, and then a lot of things can happen locally. So that's the next step we want to look at.
आणि सर सर्जरीचा खर्च उचलण्यासाठी जसं कोलॅबरेशन असते इन्शुरन्स कंपन्याबरोबर, तुमचं तसं कोणाबरोबर आहे?
Yeah, so we are affiliated to all the third party insurances. जे काही मार्केटमध्ये third party insurances आहेत, they are all affiliated to NH.
And in fact, one more good thing which Dr. Shetty has launched is called Narayana Health Insurance, which has just happened in Karnataka as of now. But sir has a big plan to roll it out across the country. And once that happens, then that's going to be a very good service, because it's at a very small premium and it covers, a good amount for surgical procedures. So that is truly which will help, and and it will also help with, which down the line, like I mentioned, if we have a center here in Goa, which I think is something which is possible.
Are laparoscopic surgeries now much more economical, let's say open heart surgery? What is the cost difference?
So now you can say, if you look at the cost, I will not be able to tell you what is the absolute cost difference, but as compared to say 10 years back, surgeries have become much economical, primarily because it's a volume, it's the numbers which matter. Previously, if you look at it 10 years back, only maybe 10% of the population was undergoing a laparoscopic surgery, but now laparoscopic or robotic surgery is like the norm. So that has increased to around 40%. So of this, what has happened is it has brought the consumables cost down. So consumable cost has come down, and because of that, they are becoming much more economical.
So how much would cardiac surgery cost now? Open heart surgery, laparoscopic, how much would it cost now?
So there are packages. I mean, I think the marketing team will be more clear on telling you what the actual packages are for the cardiac thing, But
Hi all. So it always depends on the kind of surgery. It always depends on the kind of surgery, first of all, you are looking for. And there are multiple slices to it. Beyond the surgery, there are certain medicines that come into a package. There are certain, pre and post care treatments that would be done, which would be part of the package that we've launched here. The best thing about Narayana Hospital is these packages basically make the patient aware that they don't have to spend more than a specified amount, right? Like I said, the numbers may vary. It could be 2 lakh, it could be 3 lakh, 5 lakh, more or less, we can debate over it. But the patient would always know that this is the limit up to which they are supposed to spend, not more than that, right? So this is the one advantage, which is not the case in majority of the hospitals, I would say, where it's an open billing. Right, the patient, the moment they get into it, they have to start spending. The meter runs, right, and there is no end to how much can be billed. But in our case, it's a specific amount which is part, and this is dependent on the kind of treatment that you want to avail from the hospital. Like for CABG, that is your coronary artery bypass graft, there's going to be a defined sum. For rest of the treatments like TAVI, one of the major procedures, the amount is going to be differential. But there's a package which you can avail.
कार्डियक केअरची जी स्पेशालिटी आहे, म्हणजे आता तुम्ही बोला आतापर्यंत किती सर्जरी केले?
कार्डियकच्या आता एक्झॅक्ट नंबर मला माहित नाही, पण नारायणा इज वन ऑफ द लार्जेस्ट हॉस्पिटल्स, नॉट जस्ट इन इंडिया बट इन साउथ
in the world, it is one of the largest. In fact, just off the cuff, if I say, every day there are about 30 to 40
Yes.
cardiac surgeries every day, and the OTs run 6 days a week, So it's one of the largest in the country. That is why that expertise in some surgeries is the highest.
Yeah.
Nobody else does that number of the difficult cardiac surgery, which is what we are kind of.
म्हणजे especially आता ते pulmonary endarterectomy what
Yeah.
sir was mentioning. So Dr. Shetty has the highest numbers in the world. म्हणजे I think from last time what I heard, that was 3-4 years back, he had already crossed 600. and the second person who has is around 100. So you can see the difference. So the number of म्हणजे 30 ते 40 तरी म्हणजे 30 ते 40 heart surgeries रोज होतात. So you can imagine the number of volumes which are there. There is a 750 bedded only heart hospital.
So to add to this, in fact, so to add to this, there are in fact first in India and first in world surgeries also which are performed in the center that we have, that is called as Narayana Institute of Cardiac Sciences. And sir rightly mentioned, it's a 750 bedded hospital, all beds are operational. And we make sure that the patients who are discharged from the hospital are followed up enough to understand success rate. So this is how the care beyond just surgery is extended for the patients who get discharged from the hospital.
So what's your rank in India, ranking wise?
Okay, so if you look at the largeness of the hospital, we rank either on the 5th or the 6th number, right? But we talk about Karnataka, we keep fluctuating between the first and the second rank.
आता तुम्ही टायअप करणार म्हटला, तो लॉंग रन मध्ये तुमचं फोन हॉस्पिटलचे सेटअप करायचं काय?
लॉंग रन मध्ये म्हणजे आता तर बेसिकली बघा आता तर वी आर स्टार्टिंग द सर्व्हिसेस, विल सी हाऊ इट गोज. आता तर वी हॅव टाइड अप विथ डॅफोडिल्स हॉस्पिटल विच इज इन मॉस्को टू स्टार्ट ओपीडी सर्व्हिसेस. नंतर डिपेंडिंग ऑन रिस्पॉन्स आणि कसं होते तर वी विल लुक ॲट अदर टायप्स ऑल्सो. इन अ सिच्युएशन इफ वी फील दॅट ओपीडी सर्व्हिसेस आर गेटिंग बिझियर आणि आम्हाला इकडे थोडंसं जास्त एक्सपांडेंट करायचं तर वी डोंट माइंड टाइंग अप विथ डॅफोडिल हॉस्पिटल और एनी अदर हॉस्पिटल.
But some tie-up is already there for transplant with the
DDSS. The DDSSY मध्ये आता सध्या तरी ट्रान्सप्लांट साठी टायअप आहे, काही कॅन्सर ट्रीटमेंट साठी पण टायअप आहे. अँड वी आर लुकिंग ॲट मोर टायअप्स एस्पेशली फॉर हाय एंड थिंग्स लाईक हाय एंड कार्डियक सर्जरीज किंवा हाय एंड कॅन्सर सर्जरीज किंवा रोबोटिक सर्जरीज साठी पण टायअपचं वी आर एक्सप्लोरिंग द ऑप्शन्स.
We are also making big inroads in having the government tie-up also extended for Narayana Hospital. So that's one thing, of course, eventually that would happen. We are trying to expedite the entire thing so that the large population who deserve the best medical care, they can avail it.
So you feel that in terms of Goa, is there more heart disease or more cancer? Can you do a ratio on this?
So specific for Goa, I will have to look at that data, because it's actually not coming. We are trying to get Indian data, and now the Indian Cancer Society is actually collecting data from all centers for oncology. Okay. Now similarly, we are trying to collect heart disease, diabetes, which is the newest burden now. If you look at it, we are the capital for all these diseases now in the world. So the numbers I don't think are different from a state perspective, but clearly we think that the ability to pick up some of the cancer diseases is going up. One is awareness. People are coming earlier now, even if they have a problem. Earlier people would sit. We've seen people coming with such a big lump on the neck, sitting for 1 year before they came to the doctor. Now the smallest little lump, if you notice, you're scared. You want to go and get it checked. Another thing is this annual health checkup. We keep telling people, please do it. It's a small amount. On your birthday, instead of having one big party and blowing money on something, you use that money to do a health checkup. If you do an annual health checkup, you can always pick up something early. And that is a very useful thing for both for you and your family, So that way we think that people are coming earlier to the doctors for whatever treatment, and thereby we think that we are seeing higher numbers if you look at it that way. Earlier a lot of things were not even getting diagnosed. Now it's definitely getting diagnosed. And if I look at it today, whatever is available in the US and Europe is now actually available in India. Nobody has to go out of India for any treatments now, which is a very good thing, And it's affordable for a lot of people, and that's why we want to focus and say that this should be available for everybody within our country.
From Goa, you see more heart patients or more cancer patients?
It's very difficult to differentiate because if you look at, I don't have the actual figures for Goa, but if you look at across India, both heart disease as well as cancer is increasing. So by virtue, I think Goa will not be an exception. So we will see an increase in both heart disease as well as cancer in the coming years.
What will be the reason for that?
So there are multiple reasons. Probably again the reason is not specific to Goa. It is across India and across the world also. Majority reasons are lifestyle changes, more obesity, more risk factors. But overall, we as Indians are more prone for heart diseases. And similarly, if you look at the incidence of cancer also, and I'm talking about all cancers, they are increasing.
So, we get referral in hematology sometimes when a young person comes with heart attack. Earlier days, even 10, 20 years back when we used to see patients, I should never get a 25-year-old coming with heart attack. Nowadays, we are seeing that, and we don't know, whether it is the lifestyle, whether it is the food. Similarly, like Rohit was mentioning about the cancer incident, the amount of environmental toxin, pesticides, the amount of smoke and radiation you're exposed to, nobody knows. So down the line only when we see a problem, we begin to identify. The same thing happened with cigarette smoking. For years, nobody knew that, smoking produced lung cancer. Then suddenly people, realized it.
Was it because of the COVID vaccination or something?
COVID vaccination, we are not sure, not yet. We haven't yet got data whether it contributes to heart disease or cancer. We've had issues of clotting problem. We've had some issues. I've seen patients where platelet count is dropped and they come with bleeding issues. So partly we don't know whether it's the COVID itself or whether it's a vaccine, because by now a lot of people have taken vaccine, but I think almost 90% of the population in India would have got COVID by now after 4 or 5 rounds of waves. You cannot have not. So we are all exposed. We don't know. People are still trying to now collect that data.
ओव्हरऑल सर ओपीडी नारायण हेल्थच्या बद्दल अवेअरनेस कितपत करण्याची गरज आहे असं वाटतं?
नाही, अवेअरनेस तर करण्याची म्हणून तर आम्ही हे प्रेस कॉन्फरन्स घेतो. सो अवेअरनेस वी नीड टू क्रिएट बिकॉज वी वॉन्ट पीपल टू बी अवेअर ऑफ द सर्व्हिसेस अँड युटिलाइज देम.
But you know that in Goa we go to Tata's in Bombay, which is far more, easier to do.
Yes.
So, just to answer your question, to add to what Dr. Rohit said, we are looking for partnerships. We are looking for more people who basically are willing to support us, spread the awareness that the patient really deserve. And the most awareness we are able to spread, better are the chances that the patients will turn up to the doctors for their required treatment. And then that will add to what Dr. Sharad was mentioning, the total database of the of the patients, whether they are more for cardiac cases, more for oncology cases. Then we can arrive at that number. But of course, you hit the right spot here. We need to develop more awareness, and that's why these partnerships are very important.
Now, coming to your question, I think you said about Tata Memorial Center. So yeah, correct. It is one of the largest oncology centers in South Asia. But is one Tata Memorial sufficient for taking the cancer burden of the entire country? The answer is no. The waiting times are very, very high there. Every year they see a very large amount of patients, but it is virtually impossible for them to cater to so much amount of patient load. And if you look at our center in the private sector, we are one of the largest oncology centers with volumes increasing every year by year. So we will need more centers than just one Tata Memorial to take care of all the cancer burden, because waiting time is also important. See, if somebody gets a surgery date say after 1 month, then there is a very high chance that in 1 month the cancer is going to increase. Like if you get a bone marrow transplant after 1 month, there is a very high chance that you may not get the desired result what you would have had if you got a transplant 1 month back. So त्यामुळं time is also quite sensitive. Plus time also is important because that much time the patient has to stay in that city. And staying in Mumbai as well as in any part of big city like Mumbai, Bangalore is quite expensive. So that money can be put in the treatment.
Thank you.
The vastness of the oncology program can be explained, let's say, from the bone marrow transplant program that we are running, right? We do close to about 300 bone marrow transplants in a year, which is far more than any other hospital that you will find in India. So, like Dr. Rohit said, there are other categories, like even you look at gynec oncology, you look at medical oncology. We are the biggest program as such in India. So, like you rightly mentioned, we basically are doing service to the society, and we want to have more centers where the patients can avail the benefits. And Narayana, that's why it wants to step into Goa, cater to those patients required which have really been not done so far. And that's why support from the local bodies is going to be